Hey guys, welcome back to Medical Coding with Blue. Today's episode is all about the top 3 ways that I recommend learning medical billing and coding. If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay guys, so I will get this question in batches. Blue, I know you said about all of these places to go learn medical billing and coding, but do you have a school that you recommend, even though I say I don't have a school that I recommend? And I will say this first and foremost. I cannot recommend a specific trade school to learn medical billing and coding. Why? Because I don't know the instructors. I don't have an agreement with these schools as far as, okay, this is our curriculum, this is what we teach, and this is how fast we teach it, and those kinds of things. Because the teacher and the curriculum and the books that you use, the workbooks and everything else, that's all going to play a big part in how you're learning. Okay, it does influence whether you're going to be able to absorb it quickly or whether it's going to be very confusing, because there is a workbook out there that I will not mention because I do not like this workbook. But if you've been with the channel for a while, you know which workbook I'm talking about. Now, this particular series of books does not teach brand new people, in my opinion, very well, because it's written in a way that veteran coders can understand, but not somebody who's new. So that's a difference when you're thinking about, like, okay, what are they offering? And then a lot of these schools are very fast paced. I have always said that a good program is going to be 9 months, 12 months, or 18 months. Now, some of these programs are with the colleges. So the colleges are going to try to include in other things that you may think are not really pertinent to coding. And it may not be. It may just be a part of like a package in order for them to upsell and that kind of thing, because remember, these colleges, a lot of times they are a business as well. So that's the thing. But with all that said and done, I have always mentioned there's 3 ways to learn medical billing and coding, and I really need you guys to listen to what I'm saying when I'm telling you guys this. Please don't ask me anymore about specific schools. I have been getting links to schools. I do not check those links. I automatically delete the email and I do not respond, because I've said this. And sometimes the people will say, Blue, I know you said, but can you just look at this program? No, I'm not going to look at a program and tell you about something that I don't personally know, because a program could look good on paper, but when you get in it, how is it going to be? Who is going to be teaching you? Are you going to be able to get that one-on-one time? I can't answer that. And because it's such an investment, it's not a few $100s that you're spending to learn medical billing and coding. It's often thousands of dollars. Now, I have said also before, I did a whole video about a reasonable cost for a medical billing and coding program is roughly $5,000. That's a reasonable cost. Now, give or take, okay? Now, there's some people who say, well, Blue, I found this really cheap program and it looks like they teach everything that you need to know about medical billing and coding. This is another reason why I say that I will not endorse something that I don't know. I have been approached before by a school to have my endorsement on their product, and I refused, simply because the person that's running the school has no idea about coding. All they know is about, how to sell adult education programs. That's all they know how to do, because they sell a dream. The person that runs it is a salesperson, okay? They are a salesperson 100%. I know, because I personally spoke with this person and I did not like the energy that I got. I did not like the things that they were saying, because again, they don't know about our industry. And they were trying to force me to say, oh, yes, this and this and it. No. I will never endorse something. My endorsement is not for sale. Oh, well, we'll pay you. I don't care. If you're telling me that you're going to give me money to sell a program to people that I know for a fact is not a good program, is not going to help the next generation of medical coders, you better believe I will never, ever collect money for that reason. Because the simple fact is, there's a lot of people that are, okay, if that's what they want to sell, okay, I'll be the salesperson. Nope, not me. This field means too much to me, And the next generation means too much to me. It's too important to be just throwing my opinions so willy-nilly on things and not really looking into it. Everything that I recommend and suggest on my channel is something that I personally know about. That's why you always see me with Optum, talking about Optum. That's why you always see me talking about the American Hospital Association Nellie Leon Chizen book. That's a wonderful book. That's why you always see me talking about the AAPC CPC study guide, because that's also a wonderful book, even though I'm with AHIMA. And the reason that I say that is because AAPC did a great job breaking down how to teach it, and they teach it in a way that makes sense to beginners, okay? And it's the same thing with the Nellie book. Very broken down, very easily, wonderful to understand, and it also brings in like more complex things to help you with that critical thinking. So that is what is important to me, sharing that information. And I give it freely on my channel. I give it freely. You don't have to pay to watch my YouTube videos. The only thing is you may get a few ads on some of these videos. And for some of you, that's just too much. That's just too much. Well, it can be too much all you want to. But it's part of the deal of watching YouTube videos, you know? And with all of that said, when you want to get into this and take it seriously, you have to pay attention to detail. So if you hear me say that these are the top 3 ways to learn medical billing and coding, these are the top 3 ways. This video has been done before, and it's been done a couple of years ago and a couple of years before that. and again, my cadence doesn't change. My cadence is always literally the same way. So what I said 2 years ago is the same thing I'm going to say here in 2024 is the same way. The first way of the top 3 ways to learn medical billing and coding is to go through the AHIMA website, the American Health Information Management Association. That's AHIMA, AHIMA.org is their website. Now, when you go there, in the upper right, there's going to be a little tab that says the AHIMA store. When you click on that, that's where it's going to open up and you can look at all the coding courses. They do have a 13-course bundle. This 13-course bundle can be purchased all at one time. You get all of the courses, and you have a whole year to complete. From the time you purchase it till 365 days later is when you have to complete it. No, they do not allow you to have an extension. You cannot pay for an extension or anything. But you get all of the courses all at once, and so you can pace yourself all the way through. The books that they require for those courses are to be purchased separately. So you would have to have a separate charge. So again, roughly from the cost of that program with the books, that's about $5,000, give or take, right? And so that's just to learn the coding. Now, there is no live instructor, I will say that. It is a lot of reading. So it's a lot of reading and working through the workbooks. And that's what a lot of it is. But if you're looking for extra videos to supplement, of course, YouTube is fantastic for that, right? For medical terminology, for anatomy, for pathophysiology. There's tons of channels, and I'm not going to recommend them, recommend certain ones, because again, this is a part of your learning process where you're having to do your searches and do your research, so that way you can start to learn how to find good resources, okay? And again, if you go back through any of my videos, you'll see where I have recommended certain channels and things like that, as far as like medical terminology and anatomy and pathophysiology and certain books. All of those are in the description box below. The thing that gets me though is when people will tell me, well, Blue, I know you recommend this, but what else do you recommend? Because like that's not enough, you know. And so let's practice a little bit more gratitude, okay? For those of you who are saying, oh, what else do you have? What else do you have? You need to do your research as well, okay? That's what this field is. It's a lot of research and a lot of study. But a lot of people have been successful with the AHIMA 13-course bundle. And again, it's a lot of upfront costs because it's $5,000, but that's just a one-time. However, if you cannot afford that and you say, well, Blue, that's a little bit out of my price range, is there anything else? They do have the courses a la carte. A la carte means that you can purchase them by themselves, one at a time. Again, if you go to the AHIMA store, you will see all of the coding courses. And they even have some of the specialties broken down so that way you can study the specialty itself, okay? And so you will see that. And so you can purchase those, and they're reasonable price, I think, as far as learning. So that way you can go ahead, and if you only have a couple hundred to spend, well, that's what you can look at if that's what you want to do, if you want to go through the AHIMA website to learn. Okay. Now, there's also the other one, AAPC, the American Academy of Professional Coders. Now, with AAPC, they always have sales. They do have payment plans for their program, okay? But I will say this, the way they do it is a little different. They have the medical terminology and the anatomy separate from the coding. So they say it's an option if you want to take it. And some people will skip that, and then they will just go into the coding because, oh, they can figure it out. And sometimes they'll sign up for the coding with a live instructor so that they'll be able to figure it out that way. If you are skipping the medical terminology and anatomy before you get into that coding program, you're setting yourself up to fail. Because yes, you can do independent study if you want to, but if you don't have that structure, if you don't have something that you're following like a guide, again, you're going to set yourself up for failure, because it's not just about looking at words to find the code. It's actually looking at the document and critical thinking, because sometimes these words are written differently, and providers do not have to use the same terms that are in the coding manuals in order for you to pick up certain codes. Okay, so it has to be able to translate, it has to be able to mean the same thing. And how do you know that? You know that because you know medical terminology and anatomy. Okay, but the way that they have their set up is like it comes out to 8 months if you do the medical terminology and anatomy and then you do the coding, because I think the coding is like a 4-month course, but you can pay for an extension. But altogether with those two, if you're going through with no extension, that's 8 months. Now, 8 months, I'm not going to quibble over 8 months, because I always tell people 9 months, 12 months, or 18 months. And then when I'm talking about this, people will write me in a panic and say, well, Blue, I'm learning from AAPC website and you said 9 months, but the program is 8 months. What do I do? It's just 1 month. You can still continue to study for that extra month, okay? But what I'm saying is don't get into these 4-month programs or 6-month programs, because those are too fast. And a lot of times you're just learning billing. You're not learning coding, even though they try to say that you're learning coding. You may get entry level teaching about coding, but you're not going to be in depth like you should be when you're trying to take one of the 4 main medical coding certification exams: the CCS, the gold standard of medical coding credentials, the CCA, the CCSP, or the CPC. Okay. Now the first 3 are with the AHIMA, the CCS, CCA, CCSP. These are all with the AHIMA. The CPC is the flagship credential for AAPC. So that's just something that you ought to know. But getting back to AAPC. Now, if you choose to go this way, you choose to go through their program and things like that, and there's a choice between a live instructor or self-pace, I don't know the instructor. I can't answer you if you're asking me, well, do you think I should pick the one with the live instructor? I have heard, because many people will write to me instead of writing to AAPC, they will write to me and tell me that they weren't able to get in a word in edgewise with their instructor, that it didn't really help them. And other people said, yes, my instructor was able to help me when I went through the AAPC instructor led. So again, it really all depends on where you are and the people that are instructing in that area. So that's just something that you ought to know. Do I think that you can learn it on your own? Absolutely. But there's also another alternative, okay? And I'll get to that here in a second. But if you choose to go this way, all you need is 1 certification. You do not need to add on a bunch of different specialty credentials, because AAPC has a lot of different specialties. Oh, they have certified OBGYN coder and evaluation and management coder and ER coder and all these other specialty ones. I invite you to look at the job listings and see if they're asking for those specialty credentials. I'm just saying. And again, if you're in the first 2 years of your career, you really need to stick with just one credential, so that way you can limit the number of CEUs you have to produce, because sometimes it takes a while to find a job. And you don't want to be stuck having to produce all of these CEUs. And yes, while some of those CEUs are included with the AAPC membership, which is another thing that you got to know too, because before you take your exam with AAPC, you have to be a member of the AAPC Association, and you have to be able to carry this membership. It's $210, something like that, or $205. I don't know. $200 something is the membership cost for AAPC, and you have to pay this every single year, regardless of whether you have a job or not. And in order to be able to maintain your credential on top of the 36 continuing education units you have to produce for just one. And if you don't pay the membership dues, they will revoke your credential, because AAPC is a for-profit organization. AHIMA, the American Health Information Management Association, is a non-profit organization. They do not require you to have a membership every single year, but they will charge you to report your CEUs, your continuing education units, to be able to maintain your certification, which if you have one of the medical coding certifications, a CCS, a CCA, or the CCSP, it is 20 CEUs for one certification, okay, as opposed to AAPC with 36 for just one credential. I'm just saying. So you can definitely go through that way through AAPC. Again, I would tell you that you don't need all the other bells and whistles. You just need to be able to get through the program. Now, they do have Practicode. Practicode is an educational product, and the way that they describe it on the website is going through Practicode is what you would expect to go through in the first year. It's like a sample of what you would be working if you were working a whole year, the number of records that they have you coding for. And so with all of that, it's just practice. There's no answer key to it. You just work through and you code out the scenarios yourself. It's not multiple choice, which is good practice. But this is not considered work experience. No matter what anybody tells you, this is not work experience. It is education, okay? And I've talked about that several times. A lot of people will ask me, do you think I should do Practicode? It's just extra practice. And I think extra practice in coding is always going to be great, okay? That's just my opinion anyway. And so for the final way of learning medical billing and coding, and again, AAPC is going to be roughly about $5,000, give or take, for their program as well. Now, the third and final is my independent study. Now, I came up with this originally by myself. That link is in the description box below. The thing that gets me is when people will tell me, oh, Blue, I'm looking for your independent study, but did I miss it somewhere? You cannot miss this if you're looking in the description box, because it says literally independent study list with book recommends. And you click on that, it's the YouTube video link. It's got all of the syllabus and everything. I broke down by months, like what you should do and how long you should spend and things like that. This is just a guide. If you follow it, you can be done and completed within 9 months or 12 months, okay? It's just a guide. It's just meant to give you just an idea. If you need a little bit longer with a certain portion of this study, then that's totally fine. If you go through a certain portion a little bit quicker, that's okay too. It's all about just kind of giving you a guide. And if you're studying on your own anyway, with the school, this is kind of what you would be doing. Several people have gone through this independent study and have successfully been able to pass all of the exams, the CCS, the CCA, the CCSP, or the CPC, just following that. Now, I have said on there, you go on there, you get your books, you go to Optum, because Optum is the one that they do allow with AHIMA or AAPC. You do get your choice of publisher when it comes to the ICD-10-CM book and the HCPCS book, right? HCPCS Level 2 book. You do get your choice of that. You do get your choice of ICD-10-PCS if that is going to be part of your exam. For example, if you're taking the CCS or the CCA, because both of these include inpatient coding, okay? But you do have your choice of publisher. So I will always recommend Optum, because Optum is fantastic. And I've done many demonstration videos. All you have to do is just look through my videos. And then they do have the AMA CPT Professional Edition that we all have to have. Everybody has to have the same one. And if you go on their website it's not going to be that much cheaper. That book was almost never on sale. So it's like 100 and something, 134, 135, something like that, for the CPT manual. And that's probably one of the most expensive ones. Now, if you wait a little bit, right now, the Optum ICD-10-CM and ICD-10-PCS and HCPCS books, all of these are 55% off. But if you wait a little bit closer to October, when they're going to start clearing them out because they got to make room for the 2025 editions, you can really see a good discount on those. So if you can wait for another couple of weeks or so, you'll start to see the prices really drop. And that's what I love, is to be able to get books during that time, because it's such a discount. Okay, they go like to 80% off, and so that's really fantastic, because then you can get it for like $25. Okay, so those books each, so that's something, except for the CPT manual, again, which never goes on sale. But the Optum books do. So that's always an option. Okay, get your books, get the workbooks that I recommend. And in the independent study list, there's also like links for like the CMS website. I try to update that every year, but obviously it's 2024. If I have not gotten to the link, all you have to do is just look at the link and, okay, the guidelines. You can Google the CMS ICD-10-CM official guidelines for coding and reporting, whatever year. So if you went to look at the 2024 guidelines, you can put in 2024. The PDF will pop right up and you can see that, okay? And you can download it for free. If you want to look at the 2025 guidelines, they're up as well. So all you have to do is just Google the same thing, but change the year to 2025, and boom, there you go. All the guidelines are right there. There's lots of other resources out there, and plenty that I have shared on my channel. That's the thing, guys. You guys need to go through the videos. And these simple questions I'm not answering anymore. I won't, because there's so many others that need my attention, and I have my clients and everything, and so they're going to take priority versus answering the same question repeatedly. Okay, so that's what I'm saying. So you have your choice there, and those are the options for learning coding that I recommend, because again, all of the things that I have listed there, depending on which exam that you're taking on the independent study, then you can be able to go through there. For example, if you are planning on sitting for the CPC or the CCSP, these are both outpatient credentials. So you would not need to study ICD-10 PCS, because that is not on those exams at all. All you would need to study, of course, would be ICD-10-CM, your diagnosis coding, CPT, and HCPCS. And it's all broken down in the independent study list, all right? And again, if you want to get the most current year workbooks for the Nellie book, the Nellie Leon Chisholm book, the ICD-10-CM and ICD-10 PCS coding handbook with the answers, you can totally do that if you want to. But I will say, if you want to save a few bucks, that you can go to the year prior, and it's going to be at a discount. The 2023 edition is going to be at a discount, obviously, because we're in 2024. And when you do that, then you can save some money. And guess what? It's nearly the same as the year before. So it's just designed to help you to save money. Again, I'm not here to make y'all spend all this money. I did get one person who had the audacity to complain and say, it's still too expensive. Well, then there's other programs that you can find if you do your research that will help you to pay for a program, okay? If you don't want to go out of pocket. But still, the independent study is a fraction of what AHIMA charges and of what AAPC charges. Because I think altogether it's like maybe $1,200. You can get everything, your books and everything else, and any other materials and things. It can run you about $1,200, maybe even less than that, maybe even $800. I haven't done the total in a while, but again, it's just a few $100s for your books, and of course, if you get them on sale, it's going to be a couple hundred. You can also go to the public library. The public library, you never know what you can find in the public library. Some people have found free coding classes, like medical coding classes at the public library, which I thought was like, wow, that's really fantastic. But they were able to find those there. Some people have been able to find workbooks, you know, the Nellie book. They've been able to find that at the public library. So again, you never know what they have at the public library, and just checking it out and seeing what's over there, what kind of resources there are, would be fantastic. A lot of people dismiss the public library because, oh, everything is online and everything, but you never know what you can learn and what books you have access to there. I'm just saying. So that's just my advice anyway. So those are my 3 options. Okay, those are the best 3 that I can offer and tell people to go through, because again, I don't know these schools, these private schools, or these for-profit schools, and I'm never going to endorse something that I don't know personally myself. Okay, never. And my endorsement is not for sale. If I ever do get into a deal with somebody where I'm promoting something, it's because it's something that I've been through, that I agree with, that I know personally. That's the only reason why. Other than that, I have too much integrity for that, for just to be selling, just to be telling the people, and who cares? I care. And it sickens me when I see people try to be taking advantage of people that are trying to better their life. And in the same token, it sickens me when I see people trying to rush through and put very little effort but expect a big return in the end. It needs to go both ways, folks. Y'all need to be fair, and then the schools need to be fair. Or if the school is not teaching you anything, then you can teach yourself, certainly. Because like I said, the independent study is there. And another thing before I wrap this one up, if you do choose to go through my independent study list and go through that on your own, all of that money that you saved from not going into one of these other programs and spending a few $1,000s or getting a student loan, heaven forbid, all of that money that you saved, you can certainly work through the workbooks. When you get stuck, and when you get where you don't understand something at all, find yourself a mentor. A mentor will help you for free. Or you can hire yourself a tutor. I am a tutor. My rate and contact information is in the description box below. There is also, a bunch of tutors on LinkedIn. All you have to do is make a post and look for recommendations on tutors. And there will be a bunch of people who will say who they used or whoever was good for them or what they know about so-and-so. All right. And again, if I was pushing mine, I wouldn't even say that. But again, I believe that there's going to be different people who have different learning needs. When it comes to coding and tutoring coding, I know how to do it. But I will say this also. When you are saying that you want a tutor, some of you are thinking that you want somebody that's going to give you like a lesson plan. And I don't do that. So that's something that we got to be real clear on. If you have questions, if something doesn't make sense to you, you need it explained because you don't understand like the flow of it and how is it going? How do we get to that? That's what I do. I can explain just about anything. The only thing I haven't done is interventional radiology, which I'm sure if I put my mind to it, I can really look at it and get into it. But that's like literally the only thing I haven't done. Okay. But anyway, with that said, I'm going to wrap this one up. Those are my options for you. If you're asking me what my recommendation is for learning medical billing and coding, that is my recommendation. Go to the AHIMA website, go to the AAPC website, or go through my independent study. Either one of these is just fine. You do not need to spend $20,000 to get a medical coding certification. If you're doing that, you are spending way too much money and gambling on whether you're getting a good education or not. That's all I'm saying. Anyway, with that said, I'm going to wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share, and I'll see y'all again. Bye.